Good evening, all. I'm Aditi Lama coming to you from a remote location in New York City. Welcome to tonight's episode of Vision of Asia, Voice of the Community. This is our South Asian news segment, bringing forward the coronavirus pandemic report, a nationwide perspective through political leaders and medical professionals on the ongoing impact and measures of COVID 19. If you are on the front line, do remember to share your story, your experience with us on events at itvgold.com. The total number of cases in the United States has surpassed 1.4 million with more than 85,000 deaths. Globally, there are 4.3 million recorded cases of COVID 19, with now more than 300,000 deaths. This pandemic has passed yet another bleak milestone. We send our condolences to all who are grieving the loss of a loved one. The World Health Organization today stated that this novel coronavirus may never go away and may join the mix of viruses later, and again urged all to be very careful during eased lockdown restrictions across the globe and to continue practicing social distancing. Nearly 3 million Americans filed claims for unemployment benefits last week, and more than 36.5 million Americans have sought initial unemployment since mid-March. To curb the economic ramifications of COVID 19, at least 48 states will be partially reopened by early next week, hopes to uplift the economy. The CDC today will provide guidelines on how to reopen specific types of businesses, such as restaurants and retail outlets, as well as schools and daycare. Tonight on the show, we discuss more on states such as Georgia that are reopening and its impact on daily life and hospitals, along with New York City Council on resources and others available for South Asian community. Let's now take a look at the headlines. Political commentator Pallavi Purkastha on Georgia's reopening and voter education, Georgia. Dr. Mona Sidpura and Dr. Vinil Sidpura on COVID-19 updates, tips, and social distancing, Georgia. Council member Rory Lansman addresses South Asian American Community District 24. It's time for a short break on Vision of Asia, Voice of the Community. Come right back to us. Welcome back. I'm Aditi Lama, and this is Vision of Asia, special report on the coronavirus impact and measures. We have tonight an insight into the state of Georgia and its recent developments during the coronavirus pandemic. Focused on relieving the economic ramifications of COVID 19, Georgia was one of the first states to begin the process of reopening, which allows places such as barbershops, gyms, and restaurants to reopen. This is leading to a steady climb of cases in Georgia, according to reports coming in since Governor Brian Kemp lifted the stay-at-home restrictions on April 24th. Presenting a perspective now on reopening and the impact of policy and politics, we spoke with political commentator and strategist Pallavi Purkastha. Pallavi discussed various aspects of the economic and healthcare crisis in the state of Georgia, while most importantly reflected upon civic responsibility as well as voter education during this pandemic, with her take on Georgia's primaries coming in June as well as the presidential elections in November this year. Pallavi urged all to remember to exercise their right to vote, especially now.
You're in a state that has reopened to a level that we didn't expect a state to reopen during this coronavirus pandemic. We're talking about everything from salons to tattoo parlors to restaurants, malls, bowling alleys open in the state of Georgia. I have to ask you, how are you feeling about this? And as a political, person who's really, really, into the system, how are you looking at this reopening and its impact on the state itself?
I don't feel good about it. A lot of our mayors have come out and said that they're concerned. Atlanta Mayor Keisha Lance Bottoms has come out and said she's concerned. What really concerns me is that Governor Brian Kemp, it seems like he made the decision kind of unilaterally. His own coronavirus task force did not know that he was going to open the state up until the press conference happened. And that's where it gives me pause, because it tells me that he's not listening to experts. He's maybe making a political decision. And in a state where, we have a lot of deaths already, it's a rash decision that I don't feel good about.
Do you think this is going to lead into an increase in cases and, deaths, unfortunately, due to that?
I mean, it's hard to tell because realistically, yeah, because there are people who are going out to salons, they're going to tattoo parlors. These are places you really cannot social distance, and it just leads to the spread of a virus where we don't know a whole lot about this virus. We know it's very contagious, But we've pretty much taken away any kind of the constraints to make sure that we have ways to deal with it, just because it seems, again, like a political economic decision. And yeah, I am afraid that it's going to get worse.
And what do you have to say about the other leadership of Georgia? You know, we spoke to State Representative Kosh, who also had a lot of concerns in regards to this reopening, in regards to the rising cases, and her own experience of COVID was also very current. What do you have to say about the rest of the leadership, the ones that you're interacting with?
It seems a little bit on partisan lines. Angelica Couch is my representative. I know the House Democratic Caucus is really pushing for just better rules and more restraints. The House Democratic Caucus is also pushing for expansion of Medicaid because we think that's something that's going to help people deal with something like a pandemic. But I am seeing, some Republicans kind of caution the governor. And at the end of the day, a death is a death. We're in the thousands with Georgia deaths, and the virus doesn't pick and choose whether it's a Democrat or Republican or somebody who's not interested in politics. I am seeing a little bit of bipartisan support, but for the optics of it, especially this being an election year, it seems like a very partisan.
Well, Olivia, policy and politics are kind of like the heart of this crisis right now, because it is literally all about that. I kind of wanted to take our conversation towards perhaps political education of what we should understand about what's happening here and where our voice really should come out, How should we advocate for ourselves? According to you, where is our role and responsibility and our civic duty currently with this pandemic going on?
Yeah, I think a lot of times, there are people who tell me their politics is not their thing. And it really confuses me because, when something like this comes along, it really brings to people's attention that politics is personal. We have a state Senate, we have a state House of Representatives, and these are people who make laws on a local level. So something like Medicaid expansion or access to healthcare, something like having proper schools in districts and having good funding for them. These are all decided on the state level, but sadly, these are the races that really get ignored because they're not the big races where people constantly see the candidates on TV. But it's really important for people, especially, and I'm specifically talking to the South Asian community because we lack voter turnout a little bit compared to other demographics. It's really up to us to not only vote every 2 years or every time there's an election, but also keep our representatives accountable. A lot of people watching might not know who their state senator or state representative is, and that's okay, but something like this should tell us that that kind of culture needs to change. We need to not only put the best people in office, but once we do have a state representative, once we do have a state senator, something as simple as finding them on Facebook, finding their page on Facebook and liking it, and making sure that they're giving you the information that you need, it's really important, and I can't stress that enough. The deadline for registration in the primary in Georgia just passed, but there's still time to register to vote in the November election, and people will be voting from, whether they'll be voting on their U.S. senator, they'll be voting for their county commissioners, they will be voting for their state representatives and senators. And these are the people who make laws that affect people's day-to-day lives. And it's really crucial that people start paying attention to politics, because at the end of the day, every law that gets passed, whether you like it or not, whether you're aware of it or not, will affect your daily lives.
Definitely. Let's talk about this primary election a little bit. It got moved to the month of June.
Yes.
However, it is really important that people know how the votes are going to be done, as well as the importance of voting. So let's just talk a little bit about what's happening in Georgia. What are some of the key topics that are, of importance for this particular election, according to you? And, if you wanted to educate the audience, especially the ones that are joining us from Georgia, what should they reflect upon when they're casting their vote, especially in this cycle, and then again in November?
Right. So think about healthcare is going to be a big one, whether this pandemic happened or not. We saw it in the 2018 election. We saw it in the 2016 election. Education is always going to be a big thing. The area that we live in, a lot of people move in here and pay the high property taxes just so that their children can go to better schools. I on principle, I don't like the fact that good schools are tied to zip codes, and the fact that can afford a higher property tax shouldn't mean that that's the only way to access a good school. But these are all issues that your state level legislators will make. And then on, the governor isn't up for re-election, but these are things that are important to think about, right? So in the last election, Governor Kemp won by, I believe it was less than 2%. But if you look at his leadership, if you look at the fact that there's just so much gray area and so much confusion in the way that he's leading, his own task force is coming out and saying, well, we didn't know he was going to open the state.
More on Georgia's reopening and its healthcare system. We have now our recent conversation featuring Dr. Mona Sitpura and Dr. Vinil Sitpura, who joined us virtually from the state of Georgia. The coronavirus cases are increasing and impacting communities of color with factors such as poverty, healthcare crisis, and population density, with a greater need now for more testing and other resources for the ones in need. Both doctors discuss various aspects of COVID-19 and its spread in the state, showcasing concerns for a spike in cases due to this reopening. Also providing insight into rapid testing and treatments, both doctors urge all the audience to still practice social distancing and to be careful if you are in a state that is reopening. Let's take a look at the updates and information from Dr. Mona and Dr. Vinil Sitpura discussing their frontline experience as well as their message for their fellow medical professionals.
Especially in Georgia, the number of cases and deaths has definitely been increasing. I know the curve is not accurate. It shows that it's sort of flattening, but I don't think it's accurate. However, in Georgia with the reopening, I think that we've definitely seen a lot more cases in our hospital with the availability of testing. We've been able to test much with the rapid testing much more frequently. And we've noticed that a lot more patients are becoming more positive, and then we've also had a tremendous more deaths in our hospital as well. So Georgia's reopening has definitely caused an increase in COVID patients and deaths as well.
And I want to discuss this reopening because just this past weekend, over 1,000 new cases were reported in Georgia. And Georgia was doing relatively okay in comparison to, a state like here, New York State, where, we're seeing the most number of cases. Do you think this reopening now really sort of is a huge concern for medical professionals such as yourself? And do you see a huge rise in cases because of this reopening?
I would say absolutely. The funny part about the whole thing was that the shelter-in-place order was in place until April 30th. Yet 6 days before that, on the Friday before that, April 24th, we started letting up. The governor said, "Okay, we're going to open up hair salons. We're going to open up bowling alleys. We're going to open up, even different businesses, restaurants." But the shelter-in-place was still, it was still there. And that didn't make sense because it was very contradictory. And I think as a consequence of that, I think people are starting to think, oh, as we're opening this up, hey, it looks like we're starting to flatten. It looks like things are good. We can sort of let our guard up, and continue doing what we're doing. And that's concerning. And somebody asked me in the hospital the other day, do you expect a surge over the summer, or do you think it's going to be in the winter? And before this happened, before we reopened things, I would have said I think we would be good over the summer, and I think maybe as the winter, and the fall kind of set in, I think we'd have to sort of reevaluate. But now I think it's really up in the air. I wouldn't be surprised to see another surge, at least over the summer.
Oh, wow.
Yeah.
Do you also agree with him?
Yeah, I think that especially in Georgia, I don't know. I think with the governor giving this type of hope to people and thinking that, we're in the right direction as far as having control of the whole situation, I think people are really taking this kind of laxative. They're not. Some people are not wearing masks. Some people are thinking that this is not even this is a conspiracy. I think in Georgia, it is just a very different dynamic of people where we've noticed that even when we go to places like Home Depot or anywhere, some people are not taking the right precautions. And I think that comes with a lot of the states, being loose on their restrictions. So I think that the fact that Georgia's reopening is setting an example for the whole entire country. And I think that it's dangerous because now people are not taking it as seriously, and that's going to be a problem. I think the numbers are going to spike. I think that the hospitals are going to basically not going to be able to handle a lot of this because it's now that everyone's just walking around going about their normacy. I think we're going to see a significant amount of increase in patients. Absolutely.
In terms of discussing your personal experience on the front line here, we're calling everyone here that's, a healthcare professional, a healthcare hero because of all of the service you are doing for the community here. I want to kind of get an insight into how this has personally impacted both of you. You're both married and you're both currently, on the front line. You have children. How, has this sort of changed your life? And also, what do you have to say about the resilience you've seen in the entire medical community during this pandemic?
Yeah, I think that's definitely it's been an experience for the both of us. We have 2 young children, and we both are every day we've seen probably 10 to 15 COVID positive patients each, and we come home. And the first thing we do is, run to the shower. I can't even touch my children until I take a shower and clean, and then we pick our children up from my mom's house. So and my grandmother's with her. So it's just been really difficult on a daily basis to continue to work, come home, and that fear that we're going to spread it to our children and to my mother and my grandmother. So that's been really difficult. And I think that one of the greatest things about all of this is that, as physicians, we're on the front line, but I would give a lot of credit to the nurses. I think the nurses are the ones that are seeing the patient at least 5 times probably a day. So they're going in and out. They're putting their lives on the line multiple times a day. And I think the nurses deserve a lot of credit.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, Coronavirus Pandemic Special Report, and I am Aditi Lamba. Earlier today, we spoke with Council Member Rory Landsman on COVID-19 measures in District 24th of the New York City Council. It is one of the most populous South Asian districts in New York City, where we have seen our immigrant communities in the center of this pandemic affected both economically and in the healthcare system. Council Member Rory Landsman addressed the South Asian American community, showcasing his strong support as well as resources for individuals in need, reflecting upon the economy, city's budget, the justice system, schools, and racial disparity. He also expressed his condolences for all grieving and assured that the district continues to represent and help all of its citizens. Here is Council Member Rory Landsman.
We're seeing a rise in crime. We're seeing a rise in domestic violence, especially in New York City. What do you have to say about your own observance of this, and what does the council need to do to attend to these issues of crime and violence increase during this pandemic?
Well, you look at the justice system. First thing that comes to mind, of course, is the criminal justice system. And the council, I think, played a very, very important role in trying to get as many people out of Rikers Island as possible, consistent with public safety, to protect the people, the detainees, the inmates, the civilian staff, the correction officers. And I think that the city did a very, very good job of that. And if you look at who's sitting on Rikers Island, let's just say that people of color, the immigrant community, are sadly overrepresented in our criminal justice system. But we also need to focus on the civil justice system, the things that people can find themselves in a courtroom for that is not, they've been accused of a crime, but they might be at risk of losing their apartment, being evicted from their apartment, or having their home foreclosed because they can't pay rent, they can't pay their mortgages, people who are at risk of losing custody of their children, people who have to go to court to be able to get benefits that they're entitled to. The whole civil justice system has, for the most part, frozen during this crisis. And this evening, I don't know when this is going to air, but Thursday, May 14th, 6 p.m., we're having a virtual town hall with civil legal services providers to answer people's questions on immigration, family, housing, elder law, other matters where if you don't have a lawyer to represent you, you can really be out of luck.
Any comments on tackling the problem of hunger in your district?
Yeah, I mean, the things that we take for granted, not that there aren't people in our city who go hungry every night, not that there are people in our city who have to sleep on the streets or in a shelter, but the things that we broadly take for granted are now under tremendous pressure right now. We were just in the middle of dealing with a situation where the public housing development in my district at Promenade is experiencing an acute food shortage. That last week we had almost 600 people line up for the weekly distribution of food, and it wasn't enough. So the city has allocated tens of millions of dollars more towards our regular ongoing food pantries and food delivery system. The mayor has appointed a food czar, Catherine Garcia, who is commissioner of the Department of Sanitation, and all of your local elected officials can connect you with someone or some organization that can get you food. So if you're hungry, or if you know somebody who's hungry, and everyone, let's be checking on our neighbors, particularly our elderly. If you know someone who's hungry, call us, and we will connect you to make sure that you get food.
I want to now talk to you about the economic ramifications of COVID-19, especially on New York City. I know you're currently working on a budget to protect small businesses and other outlets that are really catering to the immigrant community, businesses owned by immigrants and other communities. Your take on how are we going to stabilize the economy? And what is happening in the budgets for these small businesses? Because they're really the heart of the city.
Absolutely. And you talk about the immigrant community in my district, you're talking about particularly the South Asian immigrant community. You're talking about, look at Hillside Avenue, all the stores, all the small businesses there that are now shuttered and people can't make a living. When you talk about the economic devastation, you're talking about employees who've lost their jobs, don't have regular paychecks, and making sure that our unemployment insurance system is funded and that it's functional and that people are getting the unemployment assistance that they deserve. There's been a huge rush on unemployment claims in New York, and the state is trying to process them as efficiently as possible. There's going to be federal, city, and I'm sure state programs to assist small businesses with payroll, with loans. Just yesterday in the city council, we passed a bill that would, not, for at least for the duration of this crisis, not allow a small business owner to be personally liable for their lease if they can't operate because of COVID-19. And so I think you're going to see a lot of financial assistance. You're going to see regulatory assistance. We just passed a law yesterday in the council that all of our small restaurants were very much in favor of limiting the fees that firms like Grubhub and Seamless, et cetera, can charge, delivery fees, which are really hurting small businesses. So I think you're going to see a combination of direct financial support, loans, regulatory relief, and hopefully also those of us in the council are pushing for some kind of tax relief as well.
Schools and the education system. It is incredible how everything has gone remote, but there are students in New York City and in public schools that need access to education. I want to have your comment on what you think has happened with the education system, and how is New York City really tackling and making sure that each child gets access and resources for this.
All the kids who needed tablets have gotten them. We did a town hall meeting. My office did a virtual town hall meeting on remote learning to understand all of the different problems and challenges there are, and the lack of a unified curriculum, and of course, a lot of students. How do I put this? School is the most stable, comfortable place for them.
Right.
Home environment, for a variety of reasons, just because it's crowded and work is very hard to learn in. So, I think that we're doing the best that we can. I think there are definitely things that can improve. We hope we're going to try to limit the budget cuts to education and other youth-related programming. Obviously, remote learning is not a long-term solution. I'm hopeful, with my fingers crossed for luck, that we'd be able to open schools in September. But that really has to be entirely driven by what our public health professionals are telling us. The town hall that we had parents calling in, we had teachers calling in. People are trying their hardest to make it work.
And that is all for tonight's episode. Remember to send us your suggestions and get your organization and voices on the show. Write to us on events@itvgold.com, or you can also follow us on Facebook at itvgold. Remember to also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from New York City. I am Aditi Lamba. This is Vision of Asia. Take care and be well.